This issue was I raised this issue in 2012, February 2012, when at that time there was great fear and worry on the part of staff and indeed the general public in the Tullamore, or indeed in Derry and North Offaly, Kildare, Meath and Westmeath areas, when it was the working conditions associated with the facility which was housed at that time within Uvalia House, a HSE community care facility for the elderly and the sick. And despite the fears and worries, both parties worked to the best of their ability over time until eventually, earlier this year, HICWA said that the facility could no longer be used for that purpose, and they were forced to relocate to Tullamore on the understanding that relevant works would be carried out at the Uvalia facility for them to be back within 3 months in a temporary facility. Now, at the same time, thankfully, on foot of concerns raised by myself and many others, public representatives and the public, the HSE located a site close to the fire station in Edenderry, and planning permission was approved earlier this year also for a new facility there. And after the relocation, there was a fear on the part of staff and the locality that we could only temporary accommodation may be forthcoming within 3 months, but would the commitment that had been given in relation to a new purpose-built facility be honoured? And all public representatives took up the case, including the deputy opposite, I'm glad to say, and we sought assurances from the National Ambulance Service, from the HSE, in order to assure the public, in order to assure the staff that the new facility would be forthcoming. And we've had various correspondence from the likes of the Assistant Chief Ambulance Officer of the HSE to myself as a result of a PQ at the end of October, Mr O'Reilly. We've had correspondence to myself, to the local deputies and to local councillors from Martin Dunn, Director of the National Ambulance Service, some months ago, which was detailed and given and explained to us and local councillors 6 weeks ago. And also at that meeting, the Deputy Opposite, who was a Junior Minister of the Department of Health, confirmed what was contained within that. And the confirmation that was eminent was that not only would a temporary accommodation be forthcoming in the near future, because a site had been identified, as was detailed through some of the correspondence made available to us, but more importantly, a firm commitment was given that action would be taken on foot of the planning permission having been achieved for a new purpose-built facility. And I'm just merely using the opportunity of raising this issue on the floor of the House by means of a topical issue, so as the public can be assured for once and for all that, based on the commitments of the HSE and the National Ambulance Service, and based on the fact that planning permission has been forthcoming, and based on the fact that a site has been identified for temporary accommodation, that will be forthcoming and made available, while at the same time we can get a commitment that the new facility will start construction in the very near future. And if a date were forthcoming, it could allay everybody's fears and allow people to get on with their work, and allow the locality and the community of North Offaly, of West Kildare, of South East, Westmeath and part of Meath, and also its close proximity to the N4 is of pivotal importance in response to emergencies as they arise. So I am glad to see that the Minister is here present with responsibility within the Department of Health, and she can assure the House, and by extension those that we represent, that this will be resolved forthwith.
Thank you, Deputy Cowen. Minister.
Thank you, Count Corley. I want to thank Deputy Cowen for raising this important matter, as somebody who is as anxious as himself is in relation to the retention of the ambulance service in Edenderry, and it is a good opportunity to brief the House on the matter. As you know, since 2006 the ambulance service has operated from Uvalia House, which is a HSE care facility in the Edenderry area, a service that was most welcome when it was established 10 years ago. However, the HICWA review, as you referred to earlier, pointed to the need for some internal reconfiguration works in Uvalia House to ensure compliance with best practice. And as a result of the needs that were pointed out at that time, a fund in the order of around 2 million was provided by the last government to carry out those refurbishment works, and works commenced actually in April of this year. But because of the health and safety requirements, the National Ambulance Service had no option but to vacate the premises, and as one who visited it and saw where they were trying to operate out of when there was a building site going on around them. I could understand the decision made to put the safety and health of the people who work in the ambulance service to the forefront. While the original intention had been for the National Ambulance Service to return to Offalia House on completion of the works, as we now know, a major part of the facility which was previously used by the National Ambulance Service is no longer available due to the requirement for essential hospice beds within Offalia House. So therefore it became necessary to relocate the ambulance service to Tullamore, and I want to acknowledge the excellent service that the people who are based in Edenderry provide, and the fact that they cooperated and were so willing to understand what was going on, at the same time anxious to get back to base. So, as the Deputy does know, it is proposed to build a new ambulance station in Edenderry. The site was identified, as you outlined, and planning permission has been received. And I understand that while the development of the new station is going on, the National Ambulance Service, in conjunction with HSE Estates, is actively seeking temporary accommodation for the service within the Edenderry areas in order that the service can resume from Edenderry as soon as possible, while clarifying that, of course, they are still providing a service while based in Tullamore. Of course, we're all aware that the National Ambulance Service has undergone a very significant process of modernisation in recent years, and a number of important service innovations and developments have taken place. The National Emergency Operations Centre has been established, and with improved technology to improve response times has been provided, and intermediate care service has also been developed to provide lower acuity hospital transfers, and this frees up emergency ambulances for the more urgent calls. And of course the establishment of a permanent emergency aeromedical support service to provide more timely response to persons in rural areas has also been a welcome development. I know we all know, and indeed I'm sure you do too, Deputy Cowen, people who have had the benefit of having their lives saved because of that aeromedical support service. So at present, alternatives are also being examined to the current model of care, which requires that every patient be brought to an emergency department. And the options under consideration include hear and treat, where clinical advice is provided over the phone to callers, who can then, if appropriate, be referred to other care pathways. And we have evidence that people's lives have been saved by using this hear and treat methodology. I'm also advised that a recruitment process is underway for the necessary staff to facilitate the rollout of a pilot hear and treat model of care. The ambulance reform programme is taking place against the backdrop of the HIQA review of ambulance services, which was published in late 2014, and the National Ambulance Service Capacity Review, which was published earlier this year. The capacity review examined overall ambulance resource levels and distribution against demand and activity. Implementation of the recommendations of the capacity review will require a multi-annual programme of phased investment in ambulance manpower, vehicles and technology. And in that regard, Deputy Cowen can be assured that increased funding will be available to the National Ambulance Service for 2017. The detail of the improvements to be funded will be provided in the HSE's 2017 National Service Plan. Department of Health officials are working closely with their counterparts in the HSE and the National Ambulance Service to agree priorities in relation to the 2017 allocation.
Deputy Cowen.
Thank you. And thank the Minister for her response. You acknowledge, and rightly so, that planning permission has been sought and granted by the HSE on behalf of the National Ambulance Service to provide for and put in place a new facility in Edenderry. You also go on then to mention that there's been a National Emergency Operations Centre has been set up, and that HIQA reviews in 2014 and earlier this year talk about a capacity review and various pilot schemes in order to seek to have that brought into force and a broader rollout depending on its success or not. That's all well and good, and I wish you well with that. But can I get back to the hub of this particular issue? A commitment has been given and a permission has been sought and granted, and the public and the local representatives and myself have been assured that that will be acted on. I just need you to clarify on the floor of the House that this will proceed, and that this is not in any way, in any way moved sideways or backways because of the various reviews and the new National Emergency Operations Centre and the capacity review that has been undertaken to see what pilot schemes will bring about the potential for permanent facilities at various locations. I am interested in solving the situation, in resolving the issue in relation to Edenderry, the Greater North Offaly area and adjoining counties for which it serves. I need affirmation and confirmation that the HSE and the National Ambulance Services, having gone to the trouble of getting planning permission, having given a commitment to the locality and to its representatives, including myself and yourself, that there is no question of that commitment being lost. And we need it confirmed on the floor of the House that we can assure those people and everybody concerned that this facility will be in place and that commencement will take place this year based on the commitments that have been given
Minister, 2 minutes to conclude.
Well, as Deputy Cowan will recall, the Edenderry district convened a meeting with all of the Oireachtas members and the local councillors recently, and because of the considerations that were mooted by everybody and the concerns, I did propose that we would arrange a meeting with the HSE, because clearly they are the people who are actually delivering the service. It's not delivered through the Department of Health, and that we would convene a meeting with the senior management in the ambulance service and the Minister for Health to provide those reassurances and to provide clarity, which we all require, to ensure that people at local level are confident that the HSE are determined to push ahead with the service and the facility that the town of Edenderry and the wider area clearly deserve and would expect to have. And so I can confirm to you that we will have that meeting. The date has been mooted and proposed, and everybody would be invited to that. And I think that will be a great opportunity for us to further probe the HSE on this. I feel confident that there won't be an issue, but at the same time, it is being a project that is being developed by the HSE, and indeed it is the HSE who would be accountable for what they have done to date and what they're planning to do in the future. And I'm looking forward to having that meeting and inviting yourself and indeed all the other public representatives who required the clarity, as indeed I do myself, from them. And I really welcome that we'll have that opportunity to do it. So again, thank you, Deputy Cowan, for raising it, because it is an issue that we're all very concerned about.